Welcome to my show. A guest here. His name is John Graham Harper. Mr. John, how are you doing, sir?
Very good.
I'm so happy to hear that. Thank you so much, Mr. John. Firstly, you are the founder and the CEO of LamaFlex. You are also a certified master trainer and you're also a speaker. Can you please, Mr. John, discuss more about yourself and how you are doing currently now, Mr. John?
Yeah, I am. I run a red light therapy company. It's a medical company that focuses on red light. I have the product here in my office, this here. So this is the world's number one portable, flexible, and fully waterproof red and infrared light therapy panel. And it supports cellular energy. And by giving energy to the cells can do their job. So it's a great aid in recovery, but it also can service many different needs for the human condition. So where I came from was a fitness background. I was a competitive athlete. And like most athletes, when you're doing well in your sport, and you're excelling, you're winning medals, you're winning competitions, a lot of injury occurs. So I was severely injured, and I was introduced to red light therapy by my wife, and I was amazed by the response that my body had to be able to recover. So that led me down the road to explore what light therapy is. And about 6 years, 7 years later, I've created a product, and this product has now 8 design and innovation awards. And the awards tell the story of my journey, and also sort of what I was trying to create with the device, and how I feel that red light therapy can help change the world and heal people, because red and infrared light is natural, it's non-invasive. So it's steering people away from pharmaceuticals, from drugs, and potentially even surgery that they don't need. They just need light. They need cellular energy to be able to recover and to heal. So yeah, it's been an amazing journey. And I appreciate the lows, getting injured, because it became to a big high, which is creating an amazing product to help people.
Definitely glad about it, products, because technology. We do know that technology is the future. A lot of things technology has done to us, even assist us in one way or the other. And seeing this red light therapy assisting in one way or the other is definitely a huge development in the life we've come for today, Mr. John. So I also like to dive to the point of the area. Like from your experience with the experience you've had. From the injuries you've had during your young time, and now you're innovating a very big tool that could really help a lot of people. Do you think you've written or are you planning to write any book in the coming future on that, Mr. John?
Yeah, I'm asked a lot about writing a book. I think if I were to write a book, it would be more about just the experiences that I've had in life, the lessons that I've learned. Obviously, red light therapy, my competitive background, being healed, Lumaflex, that would all be part of the story. But yeah, that's something that I see people ask me a lot. Maybe it's the universe telling me to make a plan to write a book soon. Let's see.
Exactly. Let's see. We definitely don't know what will happen the next day. Even next week, we definitely not know. So we just have to see how things evolve. Definitely. So I would like to dive to that red light therapy, Mr. John. We do know there are a lot of therapy, though, exactly. But I know you've dived more on the red light therapy. Can you just discuss more? And how do you think it's also definitely work in a cellular level? And do you think it also differ from other light-based treatment like blue light and other light rays treatment, Mr. John?
Yeah, I mean, I think light, it's nothing, it's not pseudoscience, it's not something created in a laboratory. It's available to us outside. It's from the sun, right? But red and near infrared, this particular light over blue light, yellow light, green light, there's a lot more clinical research to support red and infrared light over other colors in the light spectrum. Not to say that I don't trust and appreciate and also endorse other spectrums of light, but I just want to focus more on red and infrared light because of the immense amount of clinical research that supports red and infrared light. I mean, I have access to a global research database where there's I believe it's 8,000, it's around 8,500 studies that is to date that is available that I can access at any time about the use of red and infrared light for the human condition. And what I want to focus is on pain management. And infrared can go deeper into the body. And this is where a lot of people have chronic pain, pain that they've dealt with for, for 20 plus years. You need a light that can go, a nanometer that can go deeper into the body to address these pains. Like for me, my left knee was an injury that I had in my athlete career that I had for many, many years. It was something that I was just used to. I thought for the rest of my life, I'm going to have this left knee issue. It's never going to go away. I just have to deal with it, But after using red light and seeing how I was healed, I understood that, a nanometer being able to go deeper into the tissue, deeper into the body and address, and provide energy to those cells in that level allowed me to heal and allowed for that, long, chronic condition to be addressed. I do tend towards, focusing more on red and infrared light. But with red and infrared light, there's many nanometers. Like the nanometers that are available in Lumaflex, for red light, it's 630 nanometers. So that goes about an inch into the body. And we have also 850 for infrared light. So infrared light goes deeper, which is about 4 inches into the body. So, but there's many more products that I'll be making in the future. And Lumaflex will have a variety of red and infrared light to address different depths into the body. But also, many of those nanometers have very strong research behind them, like the nanometer 904. This nanometer has a lot of research. 660 for red light has a lot of research as well. So it's good. Like referring to the clinical research is sort of where I talk a lot about with red and infrared light, why we use these specific nanometers and why we don't usually and perhaps in the future I'll use the blue light as well, because blue light is helpful for some conditions. But usually in the beauty space, devices that have different colors, they're usually to address beauty conditions, like making your skin look younger, addressing wrinkles, pimples, things like that. That's more the beauty area of light therapy. But for pain, we look at red and infrared light.
That's definitely impactful. Even the pain one has can definitely go deeper to the point that it will really help the person heal. And that is very, very impactful in the long way. Someone who do a lot of sport and a lot of activities that could really cause a lot of pain to really, really help one person one way or the other. I would like to dive to the point of we do know this thing heal a lot of pain, but do you think it has any effect on, or do you think it also helps in anxiety? Do you think it's something that helps in anxiety, depression, and do you think it has impacts on one person's sleep? The way a person sleeps, do you think it does have impact, Mr. John?
Yes, absolutely. I think the cause of anxiety, depression, a lot of mental conditions in the world today is just us as human beings. Number one, we don't have as much access to natural light as we should. We're over 90% deficient in natural light. And that's because, like both of us, we're indoors, we're under artificial light, and actually artificial light creates inflammation. It's not good for us. And if we as in our lifestyle now, not being as connected with nature, not being exposed to natural light, living in concrete jungles, and then exposed to artificial light, this breaks our circadian rhythm, like our phones, the way we use our phones at night and not sleeping when we should, sunrise, that's red and infrared light time. Red and infrared light is available to us throughout the whole day, but where we really get pure red and infrared light is at sunrise. And that's when we would wake up back in caveman times, that was our time when our bodies would wake up. And that circadian rhythm was when, that was our circadian rhythm: rise, sunrise, and then sleep at sunset. And at night, we would be around campfires, right? So our exposure to natural light and our circadian rhythm, this has been thrown off greatly, in the modern age that we are in right now with computer screens and cell phones. So this creates inflammation. This creates anxiety. This creates, depression and all these conditions that are plaguing the world. So when you have a device that is red and infrared light, this can help your circadian rhythm. This can help you get back, put your body clock back on. I encourage people to use their device at night when the sun sets. Use this as a lamp. Use this, turn it on, and have this like a lamp. Don't use artificial light, because this is telling you to wake up, but it's nighttime. You should be winding down. You should be going to sleep. So if you're exposed to light, you should use red and infrared light. And certainly you shouldn't be looking at your phone. So I encourage people for mental health and overall well-being, use the device in the morning when you wake up. Not all of us have access to a beautiful sunrise like Thailand or, those beautiful tropical countries. But when you wake up, the device can go on your forehead, it can go on your heart, it can go on your spine, your gut, these areas. Give your body first thing in the morning the healing light at this time, and then at the same for bed. So this can, really, not only does this help sleep, but you'll see anxiety, depression, all these will start to disappear just when your sleep schedule is on and you're not on the phone, watching TikTok and, creating this anxiety. You're eliminating. It's important to have natural light, but it's also important to resist artificial light, right? To be less on the phone, get proper sleep, try to support your circadian rhythm, turn off the artificial light, use red light as night light. That's something that there's also a lot of clinical research on this as well. Very, very good question. It's something that I wish people would know more about, how you can heal your mental health just with light, just with the use of red and infrared light. You don't need all those prescription jugs and and all of that, those and that's very harmful for us, right? It's extremely harmful for us. It creates a bigger problem, right? But yeah, I'm very glad you brought that up because it's important. It's a really important topic.
Definitely, as in I completely also agree with you. Every single thing, a lot of people, even I myself, sometimes when I turn on the lights, it just comes to my eyes. It doesn't even, usually bring that sleep on. So definitely, when someone has something that can tune someone to a point of sleeping, a lot of people use medicine most of the time in situations like this. But to use something that would definitely bring it down naturally, I'll be honest, it's really, really powerful because this life we are currently now is a life of pressure. A lot of things is what someone is thinking about. So to have something that could really tune down and could really help someone in one way or the other will definitely really impact someone in a very, very long way. I know you said that, turning it on, during the night. Do you think it has time? Like how long do you think someone should use that red light, Mr. John? And do you feel like there are any risks using the red light therapy, Mr. John?
Red and infrared light, there are no negative side effects. Remember, it's just the sun. It's just the sun. So if you're allergic, if you have a skin condition and you're allergic to sunlight, then that's an issue. But with time under red and infrared light, it all comes, like if you're trying to address a pain, like my left knee, for example. This device is designed because it's liquid silicone, so it's very flexible. So it can mold to different joints and muscles. So there's what we recommend in our protocol is 2 times a day, in the morning and at night, to address pain. And the session is 10 minutes long. So when you turn on the device, it will automatically turn off after 10 minutes. So we recommend a protocol of 10 minutes. And if it's for pain, you do 2 times a day. and then you continue every single day. An important thing to note is that consistent use of red light therapy, consistent exposure accelerates healing. So if me and you, if I'm using red light therapy a lot and I, had an injury, and then you weren't using red light, but you had the same injury, I would heal faster than you because I've been using red light therapy more. So it's an important thing to note that consistency of use, daily exposure is kind of like that's the hack to hack your body because you heal faster, right? And over time, your body becomes more and more optimized with continued use of red light. So the device, I don't want people to just use it when they have a problem. They should use it every day. You should put it on these areas of your body every day. But it's down to that consistency of use. Usually with two treatments of 10 minutes a day, I've seen personally in my, being it, having people that have purchased the device ask me about it. I've seen serious chronic issues, 20 years that they've had this pain. I've seen this pain drop from a rating of 8 to 3 or 2 in 2 weeks' time. But also, it's good to note that doctors that endorse red light therapy, that prescribe it for patients that have conditions, they usually give a prescription of a month use every day for a month. That's kind of like the doctor's prescription. But it's down to each individual. Some people, they heal fast. Other people, it takes time. I had one guy in New York. I was at a conference, and he had a shoulder that he injured playing rugby, and he's had this issue for since he was a kid playing in high school, and he couldn't lay down on his shoulder. And we did 10 minutes here, and then we did 10 minutes on the back as well. And after, he was moving his shoulder, and he's, wow, what's going on? This is crazy. He calls his wife, this is amazing. I've never heard of this before. So some people, you will see immediate change into a pain condition, and other people will take 2 weeks or a month. Depends on the inflammation, right?
Thank you so much for that insight, Mr. John. We have to just agree that every single body and person's body is different. Some people can use
Yes.
it and immediately it definitely works out well. And some people, it could take weeks, even some people sometimes months before the changes starts to get the improvement that they need. So every single body, a person body is different. I think using it in a way a person feels like it's going to work best for him or her is also one thing that's one could recommend. And also the way you've said it, I know it lasts for 10 minutes, and the way they could also use it that will definitely help them to better heal faster in time period. Thank you so much for the insight, Mr. John. Lastly, Mr. John, I would like to dive to the point. If there is any, Mr. John, if there is any misconception, Mr. John, and you would like to just dive and correct that misconception, do you think there's any misconception on people about the red light therapy, Mr. John?
Yeah, the main struggle that companies like me, right, people that have built a product, that are endorsing the use of light therapy, that are trying to elevate the whole photobiomodulation industry. The main problem we face is just simply lack of education. And many people, the issue that they have is they think it's like pseudoscience. In the early days when light therapy was discussed, it was usually like people that were very hippie, like they were the wacky, crazy scientists using light therapy. Oh my God, that you're so crazy. But over time, because the clinical research has come in, now those scientists, now those doctors, they're very, very famous now because they're like, hey, I told you so. But there's still a little bit of, there's still a significant, at least speaking for the US, in America, there's still quite a large population of people that they're like, no, I don't trust it. It's wacky, crazy, sun worshiping science. It's like, like they disregard it, and that's the struggle that we face is proper education, proper packaging of information. That's something I'm very big on, is I don't want to talk like a scientist, because everyone's like, oh, I don't understand, but they disregard it. And I've built, I have a scientist on my team, and he's my educational director. And we created a course together called the Foundations course. And this course is it's a 1.5 hour long workshop video, very very easy to follow. Maybe we'll over your lunch break you could watch the whole video. But when we built the course, I said it's very important that when we talk about red light therapy, because my scientist, he's very smart. I said, you must package the information so that it's easy to understand, and that they can, the next day, they can immediately implement red light therapy into their life. So I think we did very, very well with that. And if anybody wants access to this education, if anybody listening, you can just go to my Instagram. John Graham Fitness is my Instagram. Just say, hi, I listened to your podcast. Give me your email, and I'll register you on the back end of our academy. And you'll get a link, and you can have access to the module. That's me running the company. We obviously have a lot of products we're launching. There's lots of partnerships. We've got distribution. We're launching distribution in many different regions all over the world. But I see, like, my number one job is to grow the education, because growing the education raises the awareness of every, all the whole world. Everyone understands more, and it raises all products, all brands, all of photobiomodulation, it all benefits, right? So I see that as like my number one job. And the more students are in our academy, I see that's like the company is growing. So I think we're about 1,030 students now in the academy, on the online academy. And I just want to keep growing this and growing this. Mm.
Definitely agree with you. People, I think that's one thing that people really lack today. I think is the lack of education. When people are not, really educated about something, they find it difficult to understand what that thing is. You understand? So getting people to know that this is what this thing is all about, then they will definitely be like, wow, all right, so this is what it is all about. Then I can do this and do this and do that. Then they will definitely come into the place. But when people, I think that education will make people aware, even make people like that tell other of their friends and family that these things actually do exist. So I think that is a very, very big space someone needs to first conquer. When that happens, then everything just follows. Thank you so much for that insight, Mr. John. And Mr. John, there's a question I normally ask during the end of the show. From our forefathers, there are a lot of things that do exist during our forefathers' time that is missing in our time today. If there is anyone or anything you would like to bring back to our time today, Mr. John, what do you think that thing will be, Mr. John?
It's a good question. I mean, the word biohacking. Biohacking is this term that, people, what does that mean? Hack your health, using technology, right? Using treatments to live longer. But biohacking to me means, like you said, just remedies, treatments, protocols, behaviors that we did in our past. We're just bringing them and using them in the future. And obviously, my number one is light therapy. I think I see light as our bodies are the first priority is light. We need this more than anything else. Then it's clean water, healthy food, regular movement, exercise, right? Regular sleep. I see light as the top, thing that we need to have to keep us healthy and well. But the second one, the one that I would add, is, if I could add a second one, is grounding, is getting your feet and touching the ground. And I remember years ago when a scientist told me about this, about it's something that's definitely worth a research, understanding about grounding. I realized like, yeah, I always wear shoes. And where I go in my life, I never touch the ground. Maybe once in a long time I'll go to the beach or, but you don't really touch the ground. And it's something that when you continue to ground yourself, when you put your feet on the actual ground, on the grass, it's something that's very, very good for you. And it's very important to do. It's definitely worth a research. But light, of course, is the number one hack you can do for your body.
Hmm.
Definitely.
That shows that life, even I myself, I am just knowing is the light is very powerful. Normally we see light everywhere. We see it right at the sky, but definitely we definitely see it as probably nothing most of the time. But definitely when you start to see how powerful what it can do, then we start to give it some respect. And that is why we are saying awareness and people getting educated in this area will definitely work. I want to sincerely thank you, Mr. John, on speaking on this important topic on the red light therapy, which has really impacted what some people today. I want to thank you, Mr. John. Thank you so much, sir.
Thank you. Appreciate. Love being on the show.
All right, sir. Have a wonderful day, Mr. John. Bye bye.
Bye bye.